Hi, my name is Diana Turco. Like Dr. Litton said, I'm one of the genetic counselors in the breast center at MD Anderson, and I'm going to go over a little bit about genetic counseling and the process that people go through when they come to see us, and talk about family history, and then Dr. Arun's going to talk a little bit more about the management aspects of somebody that does have a high risk to develop breast cancer. So a lot of people aren't exactly sure what happens when they have a genetic counseling visit. So when someone has an appointment, they will meet with a genetic counselor. We go through their medical histories as well as the medical histories of their family members and draw out a family tree. And so we're trying to look for patterns that might tell us that there could be something running through the generations of their family or something that's inherited. And we can talk about different testing options for those family members. Then we can provide extra information. Some people respond to the testing or the fact that they might have a higher risk for breast cancer differently, and so also provide some support and counseling, as well as many resources. Everybody kind of learns differently. People like bulletin boards or support groups, or some people just like to read the information on their own, as well as inform people about research opportunities that we have going on within the institution. So not a lot of people realize, but the majority of breast cancer as well as ovarian cancer happens completely by chance alone or sporadically. Only about 5 to 10% of breast cancers as well as ovarian cancers are inherited or passing through the generations of the family tree. And then there's about another 15 to 20% of breast cancers that happen in what we call a family cluster, which is basically a combination of what we consider to be maybe smaller genetic factors shared within a family, as well as environmental factors, maybe areas where those individuals grew up in the same part of the country, or they lead similar lifestyles. And so we might see more breast cancer in one family compared to others, but it might not necessarily be happening in a clear pattern from generation to generation. So when we go through a family tree, we tend to look for certain, like I said, patterns or red flags that might tell us that we're suspicious that there could be something hereditary in that family tree. So we usually look for breast cancer diagnosed under the age of 50, multiple generations being affected with the same or similar cancers, multiple cancers in one person, for example, 2 breast cancers or a breast and ovarian cancer. And then we look for rare cancers like ovarian cancer, which could be diagnosed at any age, as well as male breast cancer. And then we also ask about ancestry because individuals that have Ashkenazi Jewish or Eastern European Jewish ancestry tend to have a higher likelihood to have a hereditary form of breast cancer in their family. And so the reason why we draw out the family tree and look for those different red flags is that we're looking to see, like I said, a pattern. So if you look on the right here, if you look on the right, you'll see that a sporadic family tree tends to have breast cancer diagnosed usually over the age of 50 or 60. And to kind of orient you with the family tree, the squares are men and the circles are women. And the 2 people in the center of that sporadic family tree are connected by a line, meaning that they're married. And so the one woman has breast cancer diagnosed at 71, and then her husband's mother had breast cancer at 63. So they're not even related by blood, and we tend to think that that's more of a sporadic situation where those breast cancers happen. However, on the left side, you see that there's a hereditary family because there's 2 sisters, one with breast cancer at a young age and the other with ovarian cancer, and then their father's mother had breast cancer also under the age of 50. So we can see the several generations affected, the younger ages, and then the more rare ovarian cancer. So the genes that we usually talk about that are responsible for causing hereditary breast cancer are BRCA1 and BRCA2, and a lot of people often refer to the testing for these genes as the BRCA analysis. And so just a quick biology review for everybody. We have many genes in our bodies that tell you how to grow and function. So some might tell you how to digest your food or what color your eyes should be. The BRCA1 and BRCA2 genes are in your body to protect you from getting breast and ovarian cancer. And we can do a genetic test where we draw a tube of blood and look to see are both of those genes there protecting you like they should be, or does one of them maybe have a change or what we would consider a positive genetic test result, leaving that person more susceptible or not as well protected against breast cancer as well as ovarian cancer. And so that's what the genetic testing is looking for those changes. And you can have a change in either BRCA1 or BRCA2, and you'll still have an increased risk to develop cancers. We also know another reason why we like to draw out the family trees is we know how these genes travel through the family. You have 2 copies of every gene. You got one from your mother and one from your father. And so if you look at this couple that's in the top of this picture, the individual on the right has 2 copies of their genes that are working just fine or protecting that person from breast and ovarian cancer. But the individual on the left has 1 copy that's working, but the other copy isn't protecting them, and that person's more susceptible to develop a breast or ovarian cancer. And if this couple got together and had children, they either pass on the copy that's working or the copy that isn't working, the positive genetic test result. So we tend to see about half the women in every generation are affected with a breast or ovarian cancer. And that's one reason why we're looking through the generations of family trees and not just at an individual patient. So if somebody does have a positive genetic test result, there are increased risks to get breast and ovarian cancer. And so on the left is the risk for females, and breast cancer could be as high as 85% chance to develop in their lifetime. There could be as high as a 60% chance to get a second primary breast cancer, and there could be as high as a 45% chance to get an ovarian cancer. We also can see some increased risks in men, although we kind of talk about them a little bit less. They don't have as significant increases as women do, but there might be about a 6 to 7% chance to develop breast cancer and up to a 20% chance to develop prostate cancer. And so if someone comes to an appointment, is interested in having their family tree looked at through the genetic counseling process, first we'll go through that. We'll discuss the BRCA genes, make sure they don't have any questions about how this test might be useful for them or their family members. We'll identify the appropriate patient to be tested, because it's not always the individual that comes to see us. There might be another family member that might be a better testing candidate, and so we might suggest that somebody else have their blood drawn. Once the blood is drawn, we send it to a laboratory that will do the testing for us, and they do an insurance pre-authorization there. We get a lot of questions about insurance coverage, and they will pre-authorize just to double check, since most of us aren't insurance experts. The other question that I get a lot about insurance issues and genetic testing is some people do have concerns that if I have a positive genetic test result, is there a chance that my health insurance could change my rates or drop me from my plan? But there are state and federal laws in place that protect that from happening. So one of those laws that a lot of people are familiar with is HIPAA. And then the other law that's a little bit more specific to genetics is called GINA. It's also known as the Genetic Information Non-Discrimination Act. And it protects, like I said, protects you from being discriminated against by your health insurance company, as well as protects you from employment discrimination. One thing that the laws did not protect against is life insurance. So that's one issue that we do talk a lot about with patients. Once we have sent out the blood and the testing has been started, we'll get the results back in approximately 2 to 3 weeks. And most people, because cancers do tend to be sporadic instead of hereditary, most people do test negative. Now, if there is a positive genetic test result in the family and somebody tests negative, this is good news, because they did not inherit what has caused cancer in their family members. And so that person would have the risks of the general population to get breast cancer as well as ovarian cancer. However, most of the time we see someone and they're the first person in their family tree to get genetic testing. And so if they test negative, that can be good news, but if we're still seeing lots of family members with breast and or ovarian cancer, we still need to screen that person and their family members like they have a higher risk for developing those cancers. So a negative genetic test result, while oftentimes can be good news, if we see that things are still going on in the family tree, it's not always a clear that person isn't free from risk. We still want to make sure that they understand that there could be risks to develop those cancers. And then if somebody has a positive genetic test result, that tells us that they have those higher risks for those cancers. And Dr. Arun is going to go into more detail about what we do with individuals that have positive genetic test results and what their options are. And so usually we will bring someone back in to discuss their genetic test results with a counselor and a physician. And if they're positive, or if they still have a high risk in their family for developing cancer, then we will kind of help them set up a management plan.